There's new data out this morning from CIHI, the Canadian Institute for Health Information, that says Canadians are still experiencing long wait times for some surgeries. Hospitals are trying to catch up, but it's proving to be quite the challenge. Lauren Pelly with us this morning. She's our senior health and medical reporter. She's been looking through the data and the report. Tell us about this backlog and where things stand nationally at this point, Lauren.
Well, Heather, this report was released today by the Canadian Institute for Health Information. And the biggest takeaway is that the monthly number of scheduled surgeries across Canada is creeping back to pre-pandemic levels. But it's still not enough to really clear this backlog and improve wait times for patients. Joint replacements in particular are lagging behind. Now, that's partly because of Canada's aging population, more demand in recent years for these types of surgeries, and it's because hip and knee issues are not considered life-threatening. Of course, they can mean significant pain, they can be debilitating and reduce people's quality of life, but they're not quite as high priority. Now, the latest CIHI data shows there were close to 36,000 fewer knee replacements performed nationwide between April 2020 and September 2022 compared to pre-pandemic levels. That's a 20% drop. Hip replacements weren't far behind, with 12,000 fewer procedures performed during the same period. And those drops, of course, translated to longer waits for patients. In 2022, just last year, only around half of patients had a knee replacement within the recommended 6-month time frame. That's versus 70% before COVID hit. And fewer than 60% of people had hip replacements within that recommended time frame, compared to 75% pre-pandemic. Now, this report also looked at cancer surgeries. People are also facing delays for many different types of surgeries related to cancer of a day or more. Prostate cancer in particular had delays of a week or more. And obviously we know that surgeries were canceled at multiple points in this pandemic, which led to some of these backlogs and these struggles to catch up. But CIHI also told us that healthcare staffing shortages are still a big part of this problem as well. Take a listen.
In the beginning, the trend was a little bit, especially when we got past those initial closures of things, the trend was to try and keep a little bit of hospital space available for the influx of COVID patients who might come. We're not really seeing that right now. We're seeing that continued trend where there's still space in hospitals to do some of these surgeries, but there's not necessarily the personnel to do them.
So hearing there, Lauren, from CIHI, as it's done this research, I know you also spoke with a surgeon about this issue. What are doctors saying about all of this?
Well, there's a lot of layers to this, right? You have surgeons and healthcare professionals on the front lines who are trying to grapple with this backlog and figure out how to navigate that. I'll get to that in just a bit. Let's talk first about the government side of things. So we have the provincial governments who are trying to develop strategies to improve staffing levels and catch up on these surgeries. In Ontario, for instance, there's a plan to reduce surgical wait lists by shifting more procedures to privately run clinics. That's been met with controversy. Some medical experts suggest it will actually increase the cost to taxpayers and could even worsen wait times. There's also the federal healthcare funding directed to the provinces, and that includes $25 billion or so earmarked for several priority areas, including staffing and backlogs. So that's the government side. So what are hospitals actually doing on the ground? Here's what one surgeon in Toronto told us about how they're trying to tackle these backlogs day by day.
We're operating at close to 120% of operating room capacity. We're opening up additional operating rooms on the weekends. We're opening up other care areas such as procedure rooms to act like operating rooms to deal with some of this backlog. That also allows us to try to meet the priorities of some of our more intensive, more emergent care.
Now, of course, you can have those rooms open, but you need the staff to actually run those surgeries. So there's no easy answer here, Heather, and no quick fix.
Thank you so much. Lauren Pelly live with us this morning.